Hey guys, Greg Chaplin here, physical therapist and strength conditioning specialist. And in this video, we're going to talk about why you must be able to breathe into your upper chest if you ever want a chance at improving forward head posture. We're going to first start by debunking the myth that neck breathing and upper chest breathing is responsible for forward head posture. Then we're going to show you a better way to breathe so you can actually start to get the upper rib cage to expand so that you can actually start to address forward head posture. And then we're going to end by giving you some exercise ideas that you can use to make this even more effective. So without further ado, let's go ahead and jump right in. So the common misconception is that upper chest breathing or neck activity during breathing is the cause of forward head posture. And in some ways, this is almost correct, but in other ways, it's not. So I think we have to be careful here because if we just make this blanket statement, then we're going to actually miss out on some of the benefits of being able to expand this upper rib cage to provide a better foundation for the neck and head. So let's go through what happens here first in forward head posture in terms of the position and shape of the rib cage and how that affects the neck and head, and then we'll talk about some of the neck activation as well. So if we look at the rib cage here, we could imagine that the head is going to stack kind of right on top of that. And so if we start to push this sternum down like this, and compress this rib cage, what we're going to see is that we start to get a little bit of this rounding here at this upper back region. And when that starts to happen, you could imagine if the neck was coming out from that it would just kind of continue that trajectory and the head would end up somewhere here forward of the body. So what we need to do if we want to have the head come back over the body is we actually have to be able to open up and expand this upper rib cage, and specifically really we're talking about the sternum and the front side of the chest wall, but to an extent we also need to be able to expand this upper back as well. So now the question is, how are we actually going to achieve that? So when we're breathing, there's a coordination that happens when we take a breath in, and the muscles that actually start that coordination are known as your scalenes. And those are muscles in the front of your neck that attach from your vertebrae and then anchor onto these first two ribs. And their function is to just start to move those ribs up a bit. And it's not a huge motion, but it is what starts this coordinated inhale when we start that breath cycle. So we actually need some activation in the front of the neck. So not all front of the neck activation is bad. And we need to be careful here about sort of cause and effect. So if we look at somebody who's in this forward head position, yes, are these muscles of the front of the neck maybe in a position where they have a little bit more leverage and are tight and can't let go? Yes, but what came first? Was it actually the activation of the neck, or was it more the shape of the rib cage? And I'm going to argue it's more the latter than the former. So if we want to be able to have a stable foundation where we have a good shape in the upper rib cage, we have to be able to take it from this kind of a shape to something that looks a little bit more like this. Now the question is, how do we do that, right? We don't really want to have to use a ton of effort here in the neck, right? Because that can tighten things up and restrict it a little bit. But instead, what we want to think about is we actually want to use some airflow to then open up this region instead. So how are we going to do that when it comes to an upright position? Well, it turns out that all the things you've probably already been working on, like your quiet inhalation, that's going to work really well. But we're missing one piece here, which is we know that we want to use the diaphragm as that primary muscle of inhalation. It's going to be right here at the lower rib cage, pulling down to fill the lungs up with air. However, if we have a belly here that's a little bit too relaxed, especially in the deeper abs and the abdominal obliques, what's going to happen is that diaphragm's going to come down, and as it's coming down, it might come down a little bit too quickly. It doesn't have a chance to fill this entire rib cage up with air, or the airflow is distributed in a way where it's a little bit more the lower rib cage and never quite gets up to the upper rib cage. So instead, what we want to do is have a little bit, just a gentle amount of tension in those deeper abdominal obliques and transverse abdominals to be able to oppose this downward movement of the diaphragm. And we want to extend the duration of that inhale so that we get a nice long inhale that gives a chance for that air to move from bottom to top. And by the end of that inhale, you should have this sternum coming from this position into a little bit more of this position. And if we look at what that does to this foundation here, as well as the shape of this upper part of the spine, you'll see that it goes from something like this, where we'd have more of a forward head, to something like this, where if we continue the trajectory of the neck and head, we'd have a head and neck that stay right on top of the rib cage. So to help you out here, let's go through a guided practice here first so that you can get the hang of this. So like we said, we need the diaphragm to be able to move down and have enough time to get enough air into this rib cage to actually make a shape change that happens from the bottom all the way to the top. So in order to do this, we need to be able to achieve a nice relaxed position of the diaphragm, and that's going to come on an exhale. So even though most of us will think about a breath cycle starting on the inhale and then ending on the exhale, we're going to reverse that here and think about starting on the exhale first. So we're going to do a long, gentle exhale. You could either do this through the nose or you could do this through the mouth. And if you do it through the mouth, I'd recommend you make this sound when you do it. Okay? So the key with this, whether it's nose or mouth, is to go long and gentle. Because one of the mistakes you might make is that when you exhale, you might pull down this sternum and compress this rib cage too much. So you really want to go gentle, because during the exhale phase, you really don't want much of that at all. Okay? So sometimes it even helps to take a hand, put it here on the sternum, keep that sternum tall. Then we're going to do our long exhale here. Keep going, keep going. And as you get right to the threshold of where if you went any further, you'd feel like you're squeezing, you kind of stop right before that, you'll feel a gentle pulling in your abdomen of the deepest layer of your abdominals. But what this won't feel like is a crunch. So if you've gotten to that point, the diaphragm's going to start to come up and relax a bit. And now we can go into the inhale from here. So we do that exhale. Little pause. Let that diaphragm relax. Gentle ab tension. Now we're going to inhale against that gentle ab tension. And we're going to have a nice long duration here that allows airflow to move from bottom all the way up to top. Okay, so we're going to put our hands here right below the collarbone, and we're going to do our nice long inhale. And you should feel like you get a little bit of expansion here in the upper chest, then pause, and then do your nice long exhale. Little pause. Then we're going to do our nice long inhale here. Gentle ab tension. And now you should really feel like at the end you get that upper chest to expand so that you feel like your sternum and the front of your rib cage is coming forward. Now, there's a couple of mistakes that people make here, and we've already gone through a couple of them. So trying to breathe too hard is definitely one of them. So if you can hear your breath, you're definitely breathing too hard. And if you're inhaling too fast and letting your belly go, that's another mistake. Now, the other one here that we didn't cover is sometimes we get excited and we try to move this whole rib cage as one unit rather than just letting it expand and change shape. So when you're doing your inhale, if you're starting in this kind of a shape, what we don't want to do is just take that whole rib cage and tilt it back without changing the shape. What we do want to do is allow that inhale over a long duration to allow that rib cage to naturally expand in all directions, thus changing the shape here and creating a better surface for that neck and head to then be able to rest on. All right, so now that you have a better idea of the breathing, where this really comes into play and becomes a lot more effective is when we then apply this to positions and start to have restorative exercises that help us to achieve the goals that we're setting out in order to address this forward head posture. So specifically, we said that we wanted to have a nice long runway in terms of the duration of our inhale. And to do that, we needed to have a diaphragm that was already relaxed and ascended. So in order to achieve this, oftentimes what's easiest is to get into a little bit of an inverted position, which then takes the guts and actually moves them up towards the head just by gravity. And what that does is it actually makes it a little bit easier for that diaphragm to relax upon exhalation. Then we're starting at a better position for the next inhale, and that makes it easier to go longer and gentler. And then on top of that, the airflow going from bottom to top will actually expand the upper chest first. And so you don't even have to go as long as you did if you're just in an upright, seated, or standing position. So now we're going to look at 2 inverted exercises here. And what you'll notice is I've sequenced them to go from less inversion to more inversion, because oftentimes if we're not used to that inversion, going too much too fast can often actually backfire. And if you go into something where you have to bear a lot of weight through this upper body, that's often not the best thing to start with, especially if you're someone who's been struggling with some neck or upper chest tightness and you have a low tolerance to really loading through this area. To perform this activity, you'll start in a hands and knees position with the lower body elevated. Then you'll drop down to elbows and forearms. And in this position, you'll rock forward slightly so that your nose moves over your fingertips. From here, you'll reach down through the ground with the elbows and forearms to move the rib cage slightly away from the ground. Then once in this position, you'll perform a series of breaths, doing gentle inhales through the nose. These should be quiet and inaudible. And then long, gentle exhales through the mouth. Between the inhale and exhale, you'll have a brief pause. Inhale. Pause. Exhale. Pause. Inhale. Pause. Exhale. To perform this activity, you'll elevate your knees and then drop down onto your elbows, supporting your head on your hands. You'll then walk your elbows in so you're as vertical as you can be. Then from this position, you'll perform gentle breaths in through the nose, pausing briefly at the end of your inhale, and then exhaling long and gentle through an open, relaxed mouth, making a sighing sound. And then once again, pausing at the end of your exhale, and then repeating this sequence. Gentle inhales quietly through the nose, feeling expansion in the rib cage, pausing briefly, exhaling long and gentle through an open, relaxed mouth, and then once again, pausing at the end. All right, so just to recap here, we don't want to avoid upper chest breathing. In fact, we need to be able to expand the upper chest. But the way that we're going to do this is not by creating a lot of excessive tension in the neck and just moving the rib cage as one big unit. But the way we're going to do it is by coordinating the diaphragm and abdominals to drive airflow through the rib cage to get that rib cage to change shape so we have a better foundation for the neck and head to rest upon. And if you want to dive deeper into the breathing and have a better foundation for progression with these restorative type breathing exercises, then go down to the link in the description, grab that 7-day Breathwork Breakthrough Challenge. This is going to guide you through the 7 essential breathwork practices that you need to establish that foundation. That makes everything that you do with breathing, posture, and movement a whole lot more effective. All right, that does it for this video. As always, thanks a lot for watching. And until next time, peace.